Hi, welcome back to another episode of Ask Dr. Olmos. Today we've got a question from Mary, and she says, when I have a sore neck, I don't feel like I have as much upper body strength. Why is this? Well, Mary, for a number of reasons. I've got a little video here of showing the relationship between the jaw and the neck. For every injury to either structure, it affects the other. So an injury to your jaw can cause forward head posture and neck problems, and neck injuries can cause jaw problems. Basically, whenever you turn your head, you're turning your whole spine. So any point that's injured is magnified. And so your sore neck can be coming from a source of either respiration problems or injury to the jaw itself. We see these patients who have these rotations. So this is from our center up in the San Fernando Valley, Los Angeles, Dr. Farshida Rees, and he takes photographs of the patient looking down on them with the GoPro so that you can see these rotations and torquing that the patients have. That's why one side of your neck might be more uncomfortable than the other. So as you're forward and rotated, it impinges the cervical nerves here that innervate your arms. And so you can get pinprickly feelings or loss of strength, carpal tunnel symptoms, because of the forward head posture. And these are the cervical nerves that then innervate your arms and hands. So you have the radial, median, ulnar nerves that get impinged. So depending on what finger you're having issues with, it can tell us a lot about where the actual injury site is. So people with jaw joint problems, they have this kind of a postural scoliosis, and so they're going to have chronic neck pain, back pain, hip pain, knees, feet, all the way down because their body's twisted in this way. I published a paper on this back in 2005 where we demonstrated using about 51 patients aged 13 to 74 years of age how we were able to upright their head almost 4.5 inches. Because of the inflammation in the jaw, every time you swallow, the head goes forward. So in decompressing with these little devices and the phonetic technique that I utilize, we demonstrate that regardless of the age of the person, you can see this line going through their shoulder and the distance from the ear to that line. For every inch this ear is forward of this line, it adds 10 pounds of weight to the cervical lumbar spine. And you can see how uprighted this patient is when we properly decompress. So this is what we always see in our practice is the uprighting, as you can see in these videos of the patient's forward head posture and uprighting. This is secondary to inflammatory problems in the jaw. And most of the people in the study didn't have any other physical therapy, so it was simply those issues. We also know that people have forward head posture because of breathing problems, apnea. So this paper published in the orthodontic literature shows that they took people that didn't have apnea, mild apnea, moderate, severe, and the increasing forward head posture of these people. So it could be a breathing related problem or jaw problem or both that causes forward head posture. We do know that it also leads to instability. And this paper shows that the way people carry themselves or their gait is impaired when they have a severe apnea, obstructive sleep apnea. That's where your throat closes when you're sleeping. And so this is an example from our center in North Carolina, Dr. Charles Fursley. And so you can see this woman, he has to hold her so she doesn't fall over. He's asking her to.
Let's walk forward.
You can see how difficult it is for her to try to walk. And indeed, she's going to fall over if it wasn't for that wall right there. Okay. But if you understand how to decompress properly with these patients who have these problems, you can get an almost immediate effect, and that's what the video is showing. Because her jaw was causing her head to be so far forward she couldn't balance. But now that her head's upright and now the nerves aren't pinched in her neck, that's how you get your strength back. So we have to look at the whole body to understand. As you can see now, she can walk forward and now she can walk backwards without any anybody supporting her. You can only imagine how dramatic that must be for her quality of life. This is a paper that I was asked to write for the pulmonary journals on the comorbidities between chronic facial pain and obstructive sleep apnea. So people that their throat closes at night, they have a lot of the issues of chronic facial pain and headaches. So jaw joint problems, TMJ, are related in that way. Primary headaches, that means migraine, tension type, and cluster headaches, are all related to breathing problems. Even fibromyalgia has a high comorbidity. And so insomnia, not being able to get to sleep because you're in pain, and grinding your teeth because of this disturbance, and forward head posture, the mechanisms I was just showing. So we have to look at respiration and we have to look at orthopedics in order to have someone have upright posture and now have full strength in their arms. I hope that answers your questions, Mary. Thank you.